Welcome and thank you for being here with us today. I'm Kumari Regmi. I'm a member of the Storytelling Collective, a graduate from Weave Tales, and a current delegate from the Refugee Congress from upstate New York. We are delighted to have you with us today to participate in this career panel organized by the Refugee Storytellers Collective. And I'll tell a little bit about what the Refugee Storytelling Collective is. The Storytellers Collective is a group of individuals across the United States who are experts in their lived experiences, and by sharing their stories
First manager who she respects.
and perspective, they can speak to the challenges the refugees and asylum seekers face and the contribution they can make to our society. I want to shout out a huge thank you to Basma, Haley, and all the Weebtales team, and also the collective team for giving me this opportunity today. In this panel, we'll be discussing our careers back home, and I know we're the refugees or immigrants of what your careers are back home and what you were practicing here in the United States. And about myself, I was a student back home in a refugee camp, and my childhood dream was to become a doctor. But where I grew up as a refugee, my the education system was so different that I did not actually got a formal education. It was only my dream of becoming a doctor, but I got this opportunity to come to the United States in 2009 when I was 23 years old, and I started my school and my college here, and now I'm a proud nurse practitioner and serving the elderly population here in upstate New York. So today I have three amazing panelists with me. I have Lubab, Isabel, and Sharon. So, talking about Lubab, Lubab is the Refugee Congress delegate from New Jersey. She came to the United States as a refugee from Baghdad, Iraq in 2014, along with her husband and two children. She has a medical degree with a specialty in surgical pathology and worked as a doctor and assistant professor of medicine at Baghdad. She has been working toward returning to her beloved profession as a medical doctor since arriving in the United States, but the time and the money required for licensing exams have made this a slow process for her. Another panelist with me here today is Isabel. Isabel Kayambe is a Refugee Congress delegate from Rhode Island. She escaped the civil war in Angola and spent 17 years in a refugee camp in Namibia. There, she emerged as a leader, helping fellow refugees to survive the difficult circumstances. She then began working for a UNHCR funded project inside the camp. She's trained and certified by the Rhode Island Department of Health as a community health worker and is currently pursuing a social work degree at the Community College of Rhode Island. Another panelist with me is Sharon. Sharon G is the Refugee Congress delegate from Louisiana. She's an asylee from Cameroon. Sharon is a doctoral candidate in a public policy and urban affairs. So she's also a research associate at the Nelson Mandela Institute for the Research and the adjunct professor at Southern University. She volunteers at the Communication and Strategic Partnership Director at the Louisiana Organization of Refugee and Immigrants. She helps refugees, asylees, and vulnerable immigrants transition to thrive in their new home in Louisiana. In her free time, Sharon enjoys traveling, cooking, learning new skills, interior decoration, and organizing. So I wanted to give a huge thank you for Sharon, Lubab, and Isabel for being with us here today. Now we have gone over our speakers. So I wanted to jump right into our program and into our panelists. So I will pass the first questions to Lubab, and the question goes, so Lubab, think about why you, so we talk about careers so we're talking about the career in this panel. So think about why you do the work you do every day. So take it away, Lubab.
Thank you so much for this opportunity. Actually, I inspired to be like a physician by my mom when she got like breast cancer when I was like in high school. And I was like planning to do a different career. But when I went through uh, with what my mom went through with her step by step in the hospital, I thought that I should do something like more helpful to our community. So I realized that being a doctor is like the good way to start. So I started my career in the medical school and I specialized in mainly breast cancer and early detection. And when I came to US, it was very difficult to resume my work as a physician. Especially I have like experience 10-year plus in Iraq, Baghdad. uh I didn't find like anybody like welcoming me because I don't have the license. So I spent like 3 years and a half in Texas working as a cashier, working in a store, and I realized that I'm wasting my talent and wasting my time. So I find another opportunity in the state of New Jersey, and I'm resuming my work as a physician since 2017 until now, but under the title of assistant. But I was able to prove myself valuable based on my training from Baghdad, Iraq during the pandemic by working the frontline COVID-19 fighter. Um, that's my passion, and I will continue following my passion, and I will work to build my career and build my experience. I started a campaign to support people with expertise from outside USA so that USA can acknowledge our talents. And this campaign started on 2020 until now. And I'm pretty sure at the end, the right thing will happen because there are other developed countries who are recognizing the talent like UK and Australia. Thank you for the opportunity again.
Wow, thank you, Lubab. Oh my God, when you were talking about the two things that I wanted to pick, the campaign that you were doing, it will help so many people like immigrants and refugees that are here and that were doctors and teachers back home and not able to practice here. Like for example, I have my uncle who came to United States, and he was also a doctor, but like you, it was so hard for him, and he was fighting and fighting, but obviously he started not, I don't know what he did, but he went to New York City and he stayed there for 3 years, and now he's a doctor. He just started practicing from last year, but it'll be voice for so many people, the campaign. And the other thing about the breast cancer also, me and my husband, we do the breast cancer teaching here in upstate New York every year. And this year we're doing this October 27 here in the refugee center. So it's great. There are so many refugees and immigrants people that are unaware about the primary, the screenings, because we didn't have that back in the refugee camp where I grew up, and
Right.
probably it was the same with you too. So it's just great, and thank you, Lubab. While you were there, I just wanted to add this number two questions too. You probably already did, but can you pick three words that describe the value you bring to your job, Lubab?
It's difficult to summarize like the work in 3 words, but I mean, the most important thing is the passion and keep following your dreams, no matter what the difficulties are. I'm sorry, these are more than 3 words, but this
Yes,
is the message that I would like to pass.
but yes, it's great. Thank you, Lubab. All right. So the same questions, think about why you do the work you do. I wanted to pass the same questions to you, Isabel.
Thank you so much for this opportunity. I'm Isabel. I'm the Refugee Congress delegate from Rhode Island. I do the work I do because I like working with people, especially refugees and immigrants, as the outcome is rewarding. And when I assist people to the best of my abilities, and whatever I do, the outcome, I can see the outcomes, and that's what makes me love the job that I do. Thank you.
Thank you, Isabel. And it is, yes, because I work at a refugee center. When I first came here, I know I didn't know a lot of English, but there are so many people that didn't even speak like I do. So I help them filling the paperwork, the social security, and you can see the smile on their face that, so it's just great. It's rewarding.
Mm.
So, Isabel, the second question I wanted to ask you, can you pick three words that describe the value you bring to your job?
Commitment, accountability, and responsibility. These are the three
I
words
know
that
you have so many, we don't have
I.
just three, but I'm just asking three, but yes, and
Uh,
thank you.
yes.
Thank you, Isabel. So, I know the next panelist. So, Sharon, I'm going to ask you the same questions that I asked to Isabel and Lubab. Can you tell us why you do the work you do every day?
Thank you all so much. And good evening to everyone in the panelists. Thank you all for all that you do. And thank you for having me today. Firstly, I will say that why I do what I do go way back from my foundation. And it speaks a lot from where I come from. I grew up as an only child to my mother. And I grew up as a child who never had a father figure in her life. And I saw my mother struggled to put me through the best of schools as a single mother. And I was inspired and thrilled by all she could do to ensure that the best of me comes out. And I told myself I was going to be the best version to make her proud and to be outstanding and get to the top of whatever I need to do. And that encouraged me so much coming from that background. I've always loved to help people to the best of my ability. And I was encouraged to just see myself. I told myself and I told my mama, I'm going to be a doctor. I need to get to the apex of my career. And that is why I do what I do today. It comes from a long struggle and it comes from a long inspiration of a woman who did not have a lot of education, but she decided to see me go through to get the best of myself. Thank you.
Wow, Sharon, thank you. And I know your mom is so proud of you, and we're also so proud of you. Like you said, same thing happened to me. My mother, she struggled so much, and when I was in refugee camp, the fooding, the clothing, there's nothing that 17 years. So now every day what I do is I say it's for my mom, and I share with her, and mothers are always the happiest, the proudest person. And if their children did, now I'm a mother myself, and if my daughter did a little thing at school, I get so proud. So mothers, so thank you. So Sharon, while you're here, can you pick, I know you have some more than three, but pick just three words that describe the value you bring to your job.
I would say empowerment, inspiration, and passion. Thank you.
Thank you. Thank you, Sharon.
Thank you too.
Thank you. So I know. Thank you, everyone, for picking the three words. I know you have more than three words that you bring to your job every day. We know we do so much as a doctor, as a provider, as a refugee. We're here to help, and we're born to help, right? To help and get helped. So I have I have number three questions. Lubab, if you're there, I know you already shared us about being a doctor back home and not practicing the same here, but to talk about it a little bit more. So can you, I know that doctor, what career you have back home, and are you practicing the same career here in the United States? And if not, why? I know you've said a little bit, but please
Sure.
elaborate. Thank you.
Yeah. Yeah, I came to US on 2014, and from 2014 until the middle of 2016, I was not practicing as a physician. I was like sometimes unemployed, sometimes I'm working as a cashier, sometimes even I worked in a bakery. I mean, and I was like thinking out loud, like with my husband and my family, I'm wasting my time, I'm wasting my talent. So I tried in the meantime to look for a job close even to the medical career, but I was not like welcomed, as I mentioned, because I don't have the license. I volunteered a lot. One of the biggest hospital that I volunteered is MD Anderson. It's in Texas, and I was trying to show them what expertise that I came with, and I would like to show them like my knowledge, and but it was not welcomed. And then I was able to find a job, which is like to resume my work in New Jersey in a medical lab. Basically, I'm doing exactly the same work that I was doing in Iraq, but as I told you, it's under the title of an assistant. Even the medical doctors, the US licensed doctor that I'm working with, they mentioned that I don't need any further training because the training that I have from Baghdad, Iraq, and the expertise that I brought with me are enough to fulfill the position that I'm doing. The only what I need is to be recognized to get the license. That's it. Even some of the doctors, he has like more than 12 years experience in the medical field in US. He asked me about my opinion about certain like difficult cases, and he respect my opinion. The idea of why I'm holding the campaign, it's not because I'm not satisfied of what I'm doing now. I'm satisfied, but it's the concept that why USA is unable to recognize the talent, no matter what is the talent. And I think these talented talents should be directed toward the benefit of the community and not to wasted in like unemployment or working like taxi driver or in a gas station. I think these talents should be directed for the benefit of the American society. Thank you.
Wow, Lubab, you're so inspiring. And yes, I agree. There are so many like you that are, fighting. And I know it'll, if you, keep fighting for it, I hope they will, be able to provide. And like you said, there are so many communities out there that need you as a doctor because one thing, we speak so many different languages that can help the community that are out there, like the community that are from back home, and also the community here, because we now we can also speak English along with other languages too. So we need to, I keep fighting for it, and I think we'll be able to get it. And I'm hearing so many good things about it too. For this, with COVID, I think they're still slow, but hopefully. Thank you so much for sharing, Lubab. And I think I'll ask the same questions to you, Isabel. What career you had back home, and are you practicing the same here in the United States? And if not, why?
Okay, the career I was practicing in the refugee camp because my first job was in the refugee camp, and I worked as a social worker by practice. One can ask, what is social worker by practice? A social worker by practice is somebody who practice a profession, but you don't have a degree on it. Yeah, is exactly. I think that's how is explained. Yeah, I was a social. What made me to be a social worker at that time? Many refugees were coming from my country of origin, which is Angola, and they were looking for somebody who could speak the same language with them, and who could also interpret, or people who share the same cultural values. And then I was transferred from first I was a secretary and receptionist. Then I was transferred to social work, and I became a social worker. But I was always, every 6 months, I was sent out of the refugee camp to have more trainings, so that at least I can my services can be up to standard. I'm currently doing a case management, which has some similarities with social work. It's just that social work, you have to be licensed here. You have to go to school. You have to be licensed. While case management is just a what can I say? A entry level job. And I do community health work, even social work also. I do that, but I cannot prescribe, or I cannot transfer cases. Like a social worker can transfer cases to psychologists or some like that, but case management, I just do work in general. Is mostly community services.
Yes.
Thank you.
Thank you, Isabel. I work with social worker and case management like every day with my patient at nursing home. But I wanted to ask you one thing. So I don't know if I hear it right, but did you had a degree back home? Were you a social worker back home?
Okay, I didn't have a degree back home. That's why I always say that I was doing social work by practice. I was a social worker, but by practice. I didn't have a degree
Okay.
back home, and I just had some trainings that were keeping me up to date to serve the clients in need in the refugee camp.
Okay.
And I did the social work. I did the work for 10 years.
Awesome. Thank you.
Yes.
So yes, and then it's kind of the same, the case management and the social work, a little bit different, but I can tell that Isabel from you probably do a lot lot work like a social work, but you don't get paid like a social worker do, right?
Mhm.
Yeah.
Yeah.
But thank you for sharing.
Thank you
And
too.
Sharon, I wanted to ask you the same questions of what career that you had back home. And I know you've shared a little bit, but are you practicing the same here in the United States? And if not, why? Thank you.
Thank you so very much. Actually, back home, I've kind of always been a student. I've gone to school, I believe, so much in my life. And I used to be a student. And while being a student, I was always interested to be like the voice of the voiceless. And that actually anticipated to me being like the vice president for the student government. So that was one of my motivations that triggered while at the university. And after the university, I went to volunteer for an organization called Oxeyot. It's an organization for gender, civic engagement, and youth development. And volunteering for them, actually going out to empower youth, going out to see the vulnerable, actually just triggered all which I always love to do, to help people. And that moved me to also do my master's. And after that, I was building myself to prepare to come do my PhD in the United States. So it has always been from one transition of school, empowering, getting to a leadership session to learn something new, and then coming to the United States to continue schooling. So I'm kind of doing the same thing I'm doing, just at a different level. Thank you.
Wow, Sharon, you are so inspiring, and thank you for what you do every day. But I just wanted to. So, are you a medical doctor, or are you doing like the PhD on a different field, or you have done PhD on a different field? I just wanted to.
Um, Actually, specifically, I'm a educational doctor, PhD. So not in the hospital. So all of this, my country actually has gone through a lot of crisis, and because there is no voice to the voiceless there, and those are some of the things that really triggered me to say I need to be in a place where I can have a voice, not just for my people, but for other people in that similar situation.
Yes, thank you.
Thank you.
Thank you. Thank you for what you do every day, Sharon. Oh my God, so inspiring. All right, let's move on to our the fourth question that I have. Lovab, take it away. What challenges did you face, and what advice do you have for newcomers? I know you've shared Lovab, but what advice do you have for the newcomers, Lovab? Take it away. Thank you.
Yeah, actually, you mentioned what challenges. Actually, I talked already about the challenges, and it's the time, money, and to dedicate yourself to take a license and to study. So what I faced, it was like hard for me to pay my bills versus to stay home and study 24 hours, because these license require like studying for almost a year, study and the preparation.
I agree, Lubab. It's so hard being a doctor back home and then coming here and starting like an entry level job and then even not getting a job. And if you wanted to go to school, full time school, you can afford. You have to pay rent and then buy food. It's so hard, and I can relate myself. I know I was a student back home, but I can relate my story here with Liu Lubab because my parents, my dad was a teacher back home, but he was the Nepali teacher, not an English teacher. So I know he at least earned a little bit for the family, but and he just started that being a teacher for like 4 or 5 years after before we come here. And here he can do nothing because he can't speak even a little bit of English. So starting fresh,
Correct.
while you earn a little bit at least to survive back, and then here it's so hard, and I can relate, and so many refugees can relate. But thank you, Lubab.
Yeah, I just want to add that advice for the newcomer. I know that everybody went through a difficult situation in their country of origin, the same as I went through, but it's good to start over. It's good to start afresh, although it's going to be difficult, but I'm pretty sure each one of us will, if we follow our dreams, we will reach to our dreams and we will reach to our goals. Just we need to believe in ourselves and we need others to believe in us. Thank you.
That's true, and thank you. Starting fresh. When I every time I go and share my story in the public, I say, United States, USA, you start again. You come here, you start fresh again. It's challenge, but you'll get there. You'll get to your destination when you work hard, and then you start fresh. USA, you start again. Thank you, Lubab. And I wanted to ask the same question to you, Isabel. What challenges did you face, and what advice do you have for the newcomers?
Thank you. When I arrived in the United States 6 years ago, I didn't know the importance of medical insurance. And after 2 months, I started working, and the health insurance, the neighborhood medical insurance was canceled. I stayed a few months without it because they told me that I went to welfare to complain to see whether they can give it back, and they told me that they can't because that is the system. There are you reach to a certain level, your earnings, then you can that's why they had to cancel it. And as in Africa, we negotiate. If somebody tells you about something, you have to negotiate. I went there 3 times to negotiate with the price because they told that the price was very high, the one that they were telling us to pay. And the last time I went there, I decided, okay, I'm not sick. Why am I paying? Then I stayed a few months without life insurance. And that time I stayed without health insurance, sorry. I got very sick. I was admitted at the emergency room for 4 days, and I'm paying that bill until today. And since that time, what I encourage the people, the newcomers, is just please do not ever be without health insurance in this country, because the health care is very, very expensive. And you just know the importance of it when you are already in debt. It's really very expensive. And you just know, you just see that it's expensive if you don't have a health insurance and you get sick. That's all I always tell people, that they should not stay without, as longer as you are working, the first priority have a health insurance is very important. Thank you.
Wow, Isabel, thank you. Wow, I'm sorry that you are still paying the debts from being sick. It is very expensive. Oh my God. When I can tell my story. So when I came here, my brother, we didn't know that he had a migraine headache. So we run migraine headache in our family that we find out here in the United States, and we didn't know. So my brother, the next day we came here in the United States, it was very cold and snow. So I think his migraine got, he got so sick with the cold, and we had to take him to the hospital. At least, he had, when you come, they in the New York State, they give you the Medicaid. So he did had Medicaid, and we were able to treat him. But my dad got sick probably maybe a year after, and with the same migraine headache. But I we didn't know that we had to fill out the Medicaid form that they send us every 6 months or every year. That we didn't fill that out, so I think he lost his Medicaid. So we went to the hospital. They did do everything, and then they sent us a bill of maybe like 10,000 or something dollar. And we did went back to the health, the public health, and they did, we were able to get the healthcare firm. But when I saw that bill, I was like, oh my God, how are we gonna pay that off with my housekeeping? I was doing housekeeping that time. With my housekeeping job, my mom was not working, and my other little brothers, I was the eldest in the family, and all the kids were in school. So it is very hard. And like Isabel said, I think everyone should secure their health care now than, paying the debt later, not knowing how expensive it is. And it is very, very expensive. That we didn't know back home that even if we have a headache, we always get Tylenol, and then we didn't have any insurance. If you have something come up, you just treat then and there and get it done. But here, I think it's, we have to. Isabel, thank you for sharing. And Sharon, I'm going to ask you the same questions here. What challenges did you face, and what advice do you have for the newcomers? Take it away. Thank you.
Thank you again, Kamari. Um, I would say that first, leaving everything behind, transitioning to become an asylee, coming here, adjusting to life was quite challenging. Learning new cultures, adaptability, it was quite challenging. I had to learn fast. And in my first few months being in the United States, I also faced police brutality. And it was by 4 white policemen. And that was the worst part of my life. Overcoming that PTSD and overlooking that situation. And I just had to be resilient and be strong. And that is the reason I'm doing what I'm doing, to be a voice to other people who have been victims of situations that we all have been. So no one will be able to go through that again in their life. That is some of the reason I'm doing that. And one word of encouragement will be for, to not give up. There is hope for a future. We all are value added people. We have what it takes to become who we are. We are strong, we are beautiful, we are amazing. And we have it all to become great and to make a difference in our world at large and in the society. Thank you all so much. Thank you.
Thank you, Sharon, for sharing. Oh, and I'm sorry about the police brutality that you were talking. I know so many things that I saw in the news that's, about the color and different people. It's just so hard. But like you said, being strong and working hard. We are, we're strong. We need to be strong together. The other thing that you mentioned, Sharon, we are here to encourage, help, and then be strong. So let's work together and be the voice for, and like you said, Sharon, be the voice for voiceless. There are so many people out there that you know that they can't talk. They have things going on, but they're unable to bring it out to the public. So being the voice for voiceless is, well, we are there, and um, being the voice is just a great thing. And thank you so much for being the panelists for this career panel today, Sharon, Isabel, and Lubab. And I'm seeing who's there. Oh, Ida, are you raising your hand? I don't know. I'm seeing someone's raising.
Oh no, I was just clapping.
Oh. Sorry.
And
I
the
thought
entire time that was just clapping to the amazing things that the panelists were saying.
Yes, thank you. I didn't know you were here, Ida. Did you just were you here from the beginning?
Yes, I was just a few
Oh,
minutes late, but yes,
okay.
I really wanted to hear the stories that people shared today, and
Yes, it just
they were incredibly inspiring.
it is very inspiring, and thank you. So, yeah, thank you for being here today.